Hello, class. Welcome to week 8, which we're discussing the legal and regulatory environment in healthcare. So sorry I missed early on in the week. I've been down with the flu pretty hard, and I know I'm a little bit late, so I'll be posting this video. Then I'll be posting a video for week 9 here in a little bit. So thanks for coming on in to take a look. And if you have any questions, please reach out to me. I know there are several of you that have not hesitated to reach out to me, so I appreciate that. Everybody's doing a great job in the discussion board forum. You're citing your sources. You're talking about the topics at hand and providing very succinct posts. So hopefully you're learning a lot. Hopefully you're enjoying the information. And I can guarantee you, as clinicians, as nurses, this is going to help you long term. You have to think 10, 15 years ago, information related to healthcare management, healthcare administration wasn't necessarily interwoven into the curriculum for your courses. So I'm happy to see as a healthcare administrator that we're providing our clinicians a little bit of background on healthcare admin. Now we need to get a little bit of clinical information input into our healthcare administration curriculum so our healthcare administrators understand the life of a provider. So I'm lucky I was a provider at one time, so I understand the trials and the tribulations that providers face, but of course there are some that have never been bedside their entire career. So either way, welcome again to week 8, and then pretty soon I'll welcome you into week 9. So we'll talk a little bit here. So in healthcare, we have accountability, right? We have regulations, we have rules, we have agencies, we have legislation, the Joint Commission, Leapfrog Group, DNV, EMTALA, HIPAA, ACA. We have all these things, and they all try to ensure that the business of healthcare remains above par, right? That's the intent of most legislation, we would like to think. That's the intent of the Joint Commission, the intent of Det Norske Veritas, right? They compete for accreditation to go accredit hospitals, just like Joint Commission does, and they were approved by Medicaid, CMS 10 years ago, I think, that if a hospital is accredited, then they will be eligible for Medicare, Medicaid reimbursement. They can become Medicare participating hospitals. So we have accountability to ensure that our healthcare professionals and our healthcare organizations do remain above par. We demand accountability in healthcare, don't we? Because just like anything else, healthcare is not free from a corrupt administrator. So I'm going to try to move this recording around a bit, and I don't think I can. So sorry if that's right in the middle of the PowerPoint there. We're not free from a corrupt administrator. We're not free from corrupt patients. We're not free from corrupt providers. So it's important that we have rules and regulations and accountabilities in place to be able to ensure that our patients, our providers, and our organizations and our administrators are doing what they need to do. And there's been an increase in unethical practices across the country in several industries, right? Even our politicians, they don't engage in what we would call ethical behavior all of the time. And so healthcare, like anything else, has become under a magnifying glass. This should not be reimbursement methods. This should be legislation. All right, so legislation in healthcare, we have a lot of it, right? We have HIPAA, we have EMTALA, we have the ACA, we have COBRA, we have Stark Law, we have Federal Tort Claims Act, we have tons of different pieces of legislation that impact healthcare. And why do we have all these things? We talked about all that, but at the end of the day, these pieces of legislation, they also impact the reimbursement of healthcare facilities, healthcare organizations, and providers. So we need to have a good foundation of knowledge of these different pieces of legislation. Doesn't mean we need to be subject matter experts. It just needs to mean that, hey, someone mentioned Stark Law. Well, what is that? Oh, well, that means that if I'm a provider, I can't refer my patient to an entity or organization where I have a financial interest, and we can get in a lot of trouble. And there have been organizations such as in Georgia, for example, there was a hospital a hospital group, I believe, that got into a lot of trouble because they were self-referring lots of patients in order to keep certain physicians happy, and that's also against the law. So when we talk about HIPAA, right, enacted became law in 1998, implemented in 2001, really transformed the way healthcare was provided in this country. And it took nearly 2 decades for HIPAA to be kind of redone in a sense, to be updated, right? So we have certain legislation such as HIPAA that appears to be a little bit outdated. It takes our federal government so long to update it. EMTALA, making sure that when our patients walk through our doors, they're taken care of, right? We have to conduct a medical exam. That doesn't mean if I come in with a sore abdomen that you're going to examine my foot. EMTALA means that if I come in, you can't transfer me to another hospital without ensuring that hospital can take care of me. Now, keep in mind that a lot of these pieces of legislation, sometimes they only apply to Medicare participating entities. And so if I'm a non-Medicare participating hospital, EMTALA is likely not going to apply to me, and the fines aren't going to be levied against me if I don't follow that piece of legislation. So at the end of the day, hopefully everybody's enjoyed reviewing the legislation. There's a lot of it, and if you ever decide to become certified in healthcare administration through the American College of Healthcare Executives, part of that exam, that 350 question exam, they are going to ask questions about pieces of legislation, such as COBRA, such as Stark Law. Stark Law is a big one. I remember 4 or 5 questions related to Stark Law alone pertaining to that piece of legislation. So thank you very much. Have a great day, and I will see you all in the classroom. Have a good one.